Hello, and welcome to another quick series. This time we are covering body dysmorphic disorder, so BDD. In the quick series, we're going to go over the most relevant and the most high yield information regarding these disorders that may help you in a test or in real life scenarios. And please do not use this to self-diagnose. Okay, so jumping into the criteria here, we see that the first thing is that you're going to have one or more perceived flaws on the self. Okay, so you are going to think that you have some form of a defect or a flaw, and that is going to cause you clinical distress. Okay, so notice that with other people, they are not going to be able to perceive this to the degree you perceive it. So there's going to be that disconnect. So your reality, if you have BDD, is not the same as the people around you. Let's say that you have a problem with your nose. You think it's too big. No one else will think it is nearly as big as you think it is, or as dysmorphic as you think it is. Or they will not notice anything at all because you have a completely normal nose, so you'll be disconnected from other people's reality. And once again, it's extremely important to point out that this is going to have to cause clinically significant impairment or distress. Okay, so if you have a problem with your nose and you say, oh my goodness, it is so large or it is so wide, right? And the people around you say, no, it's not, but you're not actually that distressed by it, and it doesn't impair your life. It is just an abstract thought. It is not something that is clinically impairing. Therefore, you would not actually meet the criteria for body dysmorphic disorder. Okay, and one other thing that we need to look at, because it's highlighted directly within the main criteria of body dysmorphic disorder, is that this is not caused by an eating disorder. Okay, so if you were given a test question, right, very high yield here, if they say this person is fixated on their weight, right, and other people do not perceive their weight as being a problem, or you even see the word weight in general, think first, this may not actually be body dysmorphic disorder. This could be something more like anorexia, right? Okay, great. So let's go over the criteria a little bit more in depth here. Uh, the main thing that I would focus in on is just remembering skin, nose, hair, okay? So think acne, wrinkles, nose, wide, thin, big, anything like that. All right, great. So moving on, you want to make sure once again that this is not noticeable to others or it is barely noticeable, right? So this person isn't missing a limb, they don't have a giant scar, there's nothing overtly dysmorphic about them, okay? This is something that is small, it's trivial if it exists, and it should not be causing them the distress that they are having. Okay, so going into the specifiers now, let's look at the first one, which is muscle dysphoria. You're going to see this predominantly in men, and I think this is just a really good example for us to look at in observing how body dysmorphic disorder is closely related to obsessive compulsive disorder. Think of someone who goes to the gym a lot, right? Someone going to the gym with the muscle dysphoria classification of body dysmorphic disorder is going to want to compensate for their obsession, right? So we get the adjustment right after the obsession. Okay, so to make that final diagnosis, you're going to want to indicate the degree of insight that a person has towards their disorder, right? So do they understand that their nose is actually normal and that they are overreacting, right? And they have to check it over and over and over again in order to get some sense of relief, right? Do they not get this connect, or is it completely absent? I'm not going to spend a lot of time on that because it's pretty self-intuitive, but if you want a little bit more detail, please refer back to my OCD video. I do want to point out that just like something like fictitious disorder imposed on another, right, we can have body dysmorphic disorder by proxy. So you could have this preconception of a flaw on another person, right? And this is usually going to be someone who is intimate with you, right? Your partner, okay? Um, but it could also be a stranger, a sibling, a child, right? It could be anyone, but most commonly it's going to be a significant other. So, what separates this from, say, factitious disorder imposed on another, right? Okay, in that case, it would be malingering. The way you can separate this is body dysmorphic disorder by proxy is not going to have the intention of malingering. All right, so as for average onset, right? The average person with body dysmorphic disorder is going to obtain this before 18, okay? And if they do obtain this before 18, which is going to be around 66%, they're more than likely going to have more comorbidities. We'll talk about that later, but think major depressive disorder as the big one. Okay, and the most common age of onset will be 12 to 13 years of age. However, this will be subclinical and this will develop before 18 into full-blown mental illness. Okay, so it doesn't always have to take this course, but this is the most common. All right, so if this goes without treatment, expect this to last for the duration of your life. It does not subside in the same way a personality disorder would over time, right? So as people get older with personality disorders, typically these symptoms get a little bit better. However, you wouldn't expect this with body dysmorphic disorder. This can arise at any point during your life, right? So even though it might be highest yield to screen for this at a pediatric doctor's office, right? You could see this in a geriatric population, although not much is known about this group. And now let's look at the comorbidities, okay? So the most common one, as I mentioned earlier, is major depressive disorder, just like OCD, followed by social anxiety disorder, obsessive compulsive disorder, and substance use disorders, okay? Okay, so let's go over some high yield things before we wrap up. So muscle dysphoria, think men almost always, okay? If you're going to have a comorbid substance use disorder, that's going to be men as well, okay? But with comorbid eating disorders, that will be women. Okay, so obviously this could occur with either sex, but just think high yield here, okay? If you see muscle dysphoria, it's probably going to be a man. If you see comorbid eating disorders, it's most likely going to be a woman. But once again, doesn't always have to be that way. Okay, so make sure it's not gender dysphoria. Make sure it's not olfactory reference disorder. These are going to be two things that I really think they might try to trip you up on. Okay, so how do you know it's not gender dysphoria? Well, you're not going to have a primary fixation on changing primary or secondary sex features, right? So if someone is complaining that they feel like they're in the wrong body, that is not going to be body dysmorphic disorder. Okay, also, if they're worried about a very bad smell, but even if other people can't smell this smell, and remember, this is going to be coming from them, right? So if they have this internal fear that they're releasing a very bad odor, this is not body dysmorphic disorder. This will be olfactory reference disorder. Can these be comorbid? Certainly. All right, so that wraps up this video. If you found it helpful, please consider subscribing to see more content just like this.